Hello, my name is Anna Gaku, and I welcome you to my capstone reflection video. In this reflection video, I will be discussing the contribution my teaching plan had on patient satisfaction and quality of life, the use of evidence and peer-reviewed literature to plan and implement my capstone project, how I successfully leveraged healthcare technology in the capstone project to improve patient care outcomes and communication, how health policy influenced the planning and implementation of the project. My capstone project's outcome and initial predictions, as well as my personal and professional growth throughout the project and the RN program. Evidence-based research and practice has helped me, and it helps the whole entire nursing profession to make important patient care decisions and help design context-specific interventions. Exploring type 2 diabetes, Kramer et al. States that intervention should address underlying social determinants of health and not just focus on the biological factors that cause diabetes. The intervention designed for the patient in this project was a teaching plan PowerPoint that can be implemented at a community level. The intervention outline was guided by evidence from research such as Healthy People 2020 and Pickett R's writing, which stated that community education is the best intervention for reducing the type 2 diabetes prevalence in ethnic minority communities. Now I will assess the contribution of the teaching plan on patient satisfaction and the quality of life. The teaching plan as an intervention resulted in many positive outcomes for my patient. This plan focused on teaching her about self-management skills with her diabetes, which involved glucose monitoring, nutrition, exercise, medication compliance, meal planning, and the use of technology in the management of the disease. This patient reported that out of the information gained from the education session, she found that the valuable knowledge on how to properly use the glucometer. She stated that most of the time she was not checking her blood glucose levels as she's supposed to. Sometimes she wait for her daughter to come over before she even tries to take her blood glucose level. But now that she learned the steps and practice, she feels that more confident that she will be able to do this at home on her own. The intervention also improves her experience on better understanding of the diabetes, illness, the causes, the reason behind the fluctuations of her blood sugar readings, and how food choices can impact her blood sugar levels, and as well as the symptoms that she was experiencing. As noted, many researchers, patient education and knowledge of a disease is one of the most important skills we can give patients so that they can better manage their health and their quality of life. I will now describe the use of evidence and peer-reviewed literature to plan and implement my capstone project. The project's implementation was guided by evidence from research that highlights the benefits of a coordinated care practice and patient-centered approach to designing interventions. For example, Newman's theory of expanded consciousness informed the choices of a teaching plan as an intervention because the teaching plan considered the social and economic economic environment in which the patient finds herself. The American Diabetes Association also stated that a coordinated plan that utilizes community researchers such as community health care workers leads to the lower healthcare costs and better improved patient safety. This is the reason why the teaching plan involved community workers in its implementation. Now I will discuss how I was able to successfully leverage healthcare technology into the project in order to improve communication and enhance patient outcomes. Healthcare technology plays a huge role in improving um, patient outcomes. The patient, as we mentioned, she uses the Freestyle glucometer to measure her blood sugar, and it has an integrated app which allows for storage of data to track her daily and weekly measurements. This specific patient, she wasn't able to set up the app because she's not very technologically savvy. I was able to help her, and she's a very good learner, and she realized how easy it is once the app was installed, how easy it is to just one click on her phone, and she's able to look at her blood pressure readings, and her doctor is able to assess them as well. She was The use of this technology is very important as it comes in handy when the patient speaks to the healthcare provider, as it allows the patient and the provider to stay on top of the blood glucose and make necessary changes or suggestions. Since the app also provides tips and coaching for diabetes, I was able to utilize all the resources the patient already had available to her. In future practice, telehealth should find more use in inpatient visits since most patients report that is more cost effective and convenient. In order to further improve the use of technology, it is crucial that we assess the patient's knowledge levels, capabilities in the use of telehealth. Not many patients have the knowledge about connecting with providers through visual visits, and oftentimes they don't have the necessary tools. Especially my patient is an older adult, so this is not things that she's used to. She's used to going to the doctor in person. So this was a really great way to work with her and show her other options that could make her life easy and save her time and traveling costs to the doctor's office. Now I will go over how health policy influenced the planning and implementation of my project. Nursing policies guide, guided my decision to develop a teaching plan for this patient. The American, the American Nurses Association has collaborative relationships as one of its principles. As nurses, we are encouraged to collaborate with other healthcare professionals and community networks to provide care to patients when they need it, whenever that may be. Healthy People 2020 is also a policy of ensuring the equitable provision of healthcare and removing healthcare disparities, which guided my design of the teaching plan as my intervention. Now I will discuss the capstone project's outcome and initial prediction. The capstone project, it was a learning experience for my patient in so many ways, also for me. The literature review highlighted the health disparities and the social factors which led to the high prevalence of type 2 diabetes in ethnic minority groups. My initial prediction for this capstone was the implementation of technology will be greatly benefit the patient outcome established by the teaching plan interventions of diabetes self-management. The project met my expectation on the impact of healthcare technology for managing diabetes, especially for this specific patient. It was a very good finding for her to know that she could integrate technology to help manage her disease. The aspect that fell short for the expectation was the lack of nursing policies specifically addressing providing equitable health care for minority groups. The intervention can be generalized across every population and in the management of other chronic illnesses. A teaching plan can be adjusted for every setting, thankfully, substituting for social and economic factors that are context specific. Now I will address my personal and professional growth throughout my capstone project and the RN-BSM program. The capstone project contributed to my personal and professional growth as I was working with the patient and teaching her and explaining to her all these different things she could do. I learned so much, things that I could do as a nurse, things to consider as a nurse, thinking about from the patient's point of view, because I was able to go to her home and see her family life, something that as a nurse you might not necessarily see when you work in a hospital. I was able to, because I only had one patient as well, I was able to work with her on a more personal level and design the intervention specific for her. Researching the impact of social factors on the prevalence of type 2 diabetes definitely sharpened my research skills. The whole RN-BSM program has really strengthened my research skills. The project enabled me to learn the impact of evidence-based practice on reducing type 2 diabetes prevalences, especially for minority groups. More specifically, my growth through this entire program has allowed me to become a more skilled provider. The knowledge I have gained, aside from the research skills and use of evidence-based practice to improve patient outcomes, will guide how I plan, how I coordinate care, how I treat my patients in the future practices as well, and how I work with the other members of my team. I also learned the importance of leadership, taking the leadership role in this program, because I was challenged a lot to take charge for different situations. My intervention plan involved ethical considerations and adherence to professional standards. I have read through and applied the American Nurses Association's ethical standards, especially in solving dilemmas between the lack of resources and providing quality care to patients. Thank you.